Yeah, so what I keep seeing in reports are basically a lot of times folks are reporting kind of the flipped conditional of what we're interested in. So the reports show things like among all those who are hospitalized, X% were vaccinated. And so, for example, like maybe among all those who are hospitalized, 5% are vaccinated and 95% are unvaccinated. And the problem there is that so the numerator here is going to be the number of people who are vaccinated that are hospitalized, and the denominator in that case is going to be all the people that are hospitalized. And that quantity is not very meaningful when you're trying to figure out how effective a vaccine is. And the issue that I'm concerned about with this is that is going to look very reassuring when you don't have very many people vaccinated, because if you don't have very many people vaccinated, there aren't going to be a lot of vaccinated people in the hospital. But as those vaccination rates increase, you would expect that will kind of that percent will increase, even if the actual numbers don't increase. And so, for example, if 100% of a population are vaccinated, then everybody in the hospital is going to be vaccinated because everyone is vaccinated. And so that sort of highlights why that's not the best metric when trying to figure out how effective the vaccine is. What you actually want to do is stick in the denominator, instead of all those that are hospitalized, you want to put all those that were vaccinated that were exposed. And then, you would compare that to a fraction that had the number of unvaccinated people that were hospitalized divided by all the unvaccinated people that were exposed. And so that's going to actually tell you something about vaccine effectiveness when you have that correct denominator, that bottom number. And so that's the piece that I'm sort of trying to drive home, because I keep seeing these reports that instead of talking about the number of breakthrough cases among all those who are vaccinated, they're saying the number of breakthrough cases among those who are infected. And that isn't going to give you a good idea of kind of how effective the vaccines actually are. And especially for things like hospitalization and death, we're seeing that the effectiveness is still very, very strong. And so it's, I think, really important to keep making sure that message is getting across. But in addition, I think that not only does kind of the being vaccinated, it does seem to garner some protection in terms of being infected, but it really garners protection in terms of how severe your illness is. And for an unvaccinated individual, I mean, that's just not a risk that I would want to take, because it's looking like, especially with this new variant, for unvaccinated folks, it can actually be, even for young people, it can be pretty alarming. And so I think that it's definitely worth getting vaccinated. And it's also, it's a pretty easy intervention, but getting vaccinated, you just have to get a couple shots, and then you don't have to worry about getting sick. It's much easier than a lot of the other kind of non-pharmaceutical interventions that we're having to implement now that people aren't using this really nice tool that we have. So do you mean that are you asking if people are seeing the breakthrough cases and then thinking that they shouldn't get vaccinated because they are misinterpreting?
Yes.
Yeah. So, I mean, I do think that is definitely a potential concern, and part of why I think it's so important to kind of look at the vaccine effectiveness appropriately, because across the board and multiple studies that have come out, especially against severe disease, these vaccines are being shown to be super effective. Even ones, so, what I've been talking about recently has been making sure you have that right denominator. So when you're comparing, you want to compare, basically, I want to know my probability of getting sick given I'm vaccinated, and I want to compare that to my probability of getting sick given I'm not vaccinated. And that comparison kind of across the board in multiple studies is being shown that the probability among the vaccinated is much lower than of getting sick compared to the unvaccinated. But in addition to getting that denominator correct, the other thing you want to make sure you're doing is making apples to apples comparisons between the unvaccinated and vaccinated populations. And so sometimes you have to adjust for certain factors to make sure you're doing that appropriately. And there have been some good studies that are actually matching people to try to make that apples to apples comparison that are still showing that these vaccines are very, very effective. And so I guess all that is to say that when the data is looked at appropriately, we're still seeing that the vaccine, especially against severe illness, is super effective. Unfortunately, it does look like in terms of just infection that there is a reduction in the effectiveness with the new variant, which is why, now people who are vaccinated are being asked to be more cautious for the sake of unvaccinated people. But that, I think, I have 2 small children. And so when I'm thinking about that, about being more careful, I'm thinking of it in the context of children under 12 who don't have the option to get vaccinated. And so I can see the frustration where it feels like people are having to change behavior for a group of people that are choosing not to be vaccinated. But there are also, there's a large number of people who are not making that choice, but just don't have another option. And I think it's worthwhile to be cautious for that group too.